Islam, and unfortunately Dr. Zaki couldn't be here. It's a joint paper. Thank you very much for coming.
Thank you very much. Very good morning. I am very much proud to be here in front of you, and special thanks to the myself and his colleagues and others who organized this special conference. And I am very much glad to be present here. Okay. My name is Dr. Mohammad Saiful Islam. I am working in the Department of Planning and Research, Director General of Health Services under Ministry of Health and Family Welfare. One of my colleagues named Dr. Kazi is the first author of this research paper, and I jointly worked in this paper. So I am presenting my PowerPoint presentation. The attention is ethical challenges in implementing outbreak investigations and recommendations in Bangladesh 2007 to 2024. In Bangladesh, Institute of Epidemiology, Disease Control and Research (IEDCR) and Disease Control Division (CDC) and NCDC, communicable disease and non-communicable disease, conduct outbreak investigation in Bangladesh. Responses are conducted by NRRT, DRRT, URRT, that means National Rapid Response Team, District Rapid Response Team, and Sub-District Upazila Rapid Response Team, and coordinated by Public Health Emergency Operations Center at central level. IEDCR and CDC being the IHR, International Health Regulation Act 2005 and 2018, reporting institutes are responsible for Public Health Emergency Prevention Center investigations and reporting to World Health Organization. Emergency public health responses often require anthropological, epidemiological, and environmental investigations. If we look our outbreak response system in Bangladesh, there is a routine indicator-based surveillance system and event-based surveillance system. Those surveillance systems are coordinated by Emergency Operations Center, which is established at IEDCR at central level. When emergency response, there are 2-3 teams who are working in national level: National Rapid Response Team, District Rapid Response Team, and Upazila, that is Sub-District Rapid Response Team, and multi-sectoral approach collaboration is working on. If we look at the multidisciplinary problem solving One Health approach, IEDCR, CDC, and other GO-NGO collaboration, there is a special team: epidemiologists, veterinarians, clinicians, anthropologists, wildlife experts, and ecologists. A new professional culture to solve this complex problem. Ethical issues in outbreak investigations are ethical approval prior to such investigations and implementing interventions are often challenging to obtain. We aim to describe the ethical challenges while implementing recommendations of outbreak investigations in Bangladesh. Methods. We access outbreak investigation data from IEDCR and analyze descriptively. We estimate that the proportion of outbreaks requires international health regulation, IHR, public health emergencies, and international concern notifications, vaccinations, and chemoprophylaxis treatment. Identify the method or approaches of outbreak investigations, that is quality and quantity, and other investigations. Interviewed stakeholders of investigations and IHR focal point in Bangladesh regarding ethical requirements for outbreak investigations. Explored ethical challenges for sample collection and laboratory investigation from human, animal, and environments. Describe challenges encountered while implementing recommendations to contain or control outbreaks. If we look at our results, total 470 numbers of outbreaks were responded during 2007 to 2024, a total 82%, 343 by 417, almost 80% where infectious disease outbreaks occurred in last 2 decades. Almost all outbreaks requires collection of blood sample, urine sample, or CSF of oral swab and nasopharyngeal swab or stool sample from human cases on control. Animal samples were collected from domestic, peri-domestic, and wild animals. Animal samples collected both from live and dead animals. If we look the bar diagram, so initially 2007 it was reported 12 cases, then sharp rise, and if we look at the 2014, that is gradually increased the number of outbreaks in Bangladesh, and 2018, then fall down number of outbreak in occurrence. Brother, no informed written consent was obtained from human cases or for animal sample collections. Around 60 to 70% of investigations recommendations were from case control, descriptive study, and qualitative studies. Formal institutional review board, that is IRB, approvals were not available for epidemiological investigations during the investigation or outbreak activities. Specific guidelines for animal sample collection for outbreak investigation were not available. One Health approach investigation also lacked coordination guideline to address potential ethical issues. These are the activities done during outbreak in the field level, conducted by IADCR and other stakeholders. So, most of the ISR reportable events were not reported unless the intervention was directed as per IHR and PHEIC mandate. Confidentiality of all personal information were strictly maintained. Cases received emergency interventions, including clinical treatment, vaccinations, isolations, and quarantine, risk communications, behavior change communication whenever necessary. Isolation of quarantine of cases were done under existing National Disease Control Act and often lacked informed written consent. Confidentiality or beneficence were properly maintained. However, autonomy was compromised during sample collection, testing, or ensuring isolation and quarantine. Research conducted and communicated lacked proper ethical approval. That is our challenge. Public health practices need to be contextualized to ensure autonomy and disruptive justice and ethics approval of research during outbreak investigation. National guidelines addressing ethical issues need to be developed by the stakeholders and policymakers. These are the ethical challenges during outbreak investigation to find out the source of infection and control and other activities. Thank you very much.
Thank you. I'd like to open up for discussion, questions. Can you go back to your several of your slides back? So it's animal investigations. How, I mean, your directorate or ministry
Yes.
covers all types of infectious agents or specifically on animals?
So, under the Ministry of Health and Family Welfare, we have 2 or 3 specialized institutes, that is IEDCR, and some cases National Institute of Public Health and Preventive Medicine, NIPSOM, and other stakeholders, all are engaged to conduct epidemiological investigation, and it is done by our Ministry of Health and Family Welfare. And we have some collaboration with other organizations like WHO and different NGOs and other technical persons. So on the other hand, this is One Health approaches. That is veterinarian, animal health science expert, wildlife expert, and we have veterinary university in Chittagong. They are also involved because under the umbrella of One Health approaches, we would like to conduct and done by activities to conduct epidemiological investigation during outbreak.
Okay. If you can, I would like to know how the People's Revolution in Bangladesh affected the infrastructure for public health safety. Because some of the senior positions may have been political appointees and may have changed, but many of the medical staff may have stayed. So if you're comfortable, I'd like to know, and was there any change because of that? I mean, again, it would be an interesting subject that, you think about the control of information. New government may not want to say there's an increase in disease, or they may want to always say they're better than the previous administration. But because of some disruption may have occurred, do you think some disruption occurred, and how did it affect is it now back to the same standard, or at least in terms of scientific quality? And was there any disruption of services?
Thank you very much. This is very good question, and this is one of the challenges to our health system to work because as a government employee, most of the employees are not staying their places a long time. They transferred for different places, they got promotion to uphold their career planning. So this is one kind of challenges. But nowadays, government has taken initiative to develop some expert in public health that is done by the Field Epidemiology Training Program under the CDC, US CDC. So nowadays, more than 100 field epidemiologists are developed, that's the MSc course in Bangladesh, and they will work all over the country where they are posted. They will work in public health sector. They will work as a Upazila, that is sub-district level. They will work as a district level and central level. Any places where they are posted, they will work in the guideline of this IHR and the field epidemiology program. So now we can minimize this issue, the frequent change of our policymakers or experts from one place to another place, and we address this issue for sustainable and quality healthcare system.
So in that sense, is it may hopefully more sustainable? Yes, in some countries, countries vary in terms of the political involvement in scientific agencies, and I think it's sad when we have too many political appointees in agents, and also I think in some countries, as part of a punitive discrimination against employees, they may be moved to a remote station as a punishment. Yeah, and let's hope that you can have a longer and stable infrastructure, which is better for infectious disease monitoring. Also, you mentioned CDC, and I hope that after its recent challenges in the United States, that international disease monitoring will be stable. It's some of these questions are difficult, but let's hope for stability and scientific expertise.
Yeah. Thank you very much. In the line of this recent issue, we have a government department, Chronic Communicable Disease Control. That is our government department, CDC, and also Non-Communicable Disease Control, that is NCDC. They are totally worked by government support. Previously, the World Health Organization and USCDC, they developed the public epidemiologist expert by this time. Now they are working under the government health ministry, and nowadays this issue is minimized because we are government funded, we are developing this expertise, not 100% dependent on the CDC, but they provide the technical support during the initiation of this course. Now we are working independently.
Thank you very much for excellent overview. Any other comments or questions? Yes, please.
Thank you for giving me the opportunity. I'll just add to Dr. Saiful's comments on private sector part. Actually, in Bangladesh, government and NGO sector, the private sector works together for the better development. And I will just share the situation during the COVID. What our organization did that time, we dedicated in our northern region, we opened a dedicated hospital. We opened it for the COVID, and to tell one thing, for the RT-PCR, we have done 38,000 RT-PCR tests that time. Just only one center. But other centers, they are having problem with the machines and other things, but we didn't stop. And another thing, in our hospital, the infection control, the way we manage it, our medical faculty and the health professionals are not that much infected, or the casualty is there. So that is one of the things I want to share in this forum. And the recent thing, what is happening with the government, I want to congratulate the present government, our present health advisor. We are working closely on these issues, especially on cancer, on the precision diagnosis and precision treatment. We are the first in Bangladesh open the biomolecular lab, which is ISO 15189 accredited. Thank you.
So I can add something here to control the pandemic COVID-19. The whole of Bangladesh, we established 46 ICU at district level, where 30 lakh people are residing there, and we established 29 modern microbiology labs all over the countries, and also we don't have oxygen facilities, liquid medical oxygen during critical care patients. So we established 100 liquid medical oxygen systems all over the Bangladesh during pandemic. So we have built up our capacity in hospital services and diagnostic facilities and awareness development of the community and stakeholders, how we work together, and all together we combat the COVID-19, and the total death in our country is 29,000, because we are huge population, 18 million population. In terms of this the COVID pandemic, only 29,000 deaths. So we have morbidity patients, but we control, and very much important activity we did on that time, that's vaccination program. We successfully done the vaccination program nationwide, as because we have established expanded program of immunization. It was 180. So that's why it helps us to vaccination program nationwide successfully.
Thank you so much for the information. Okay, Sabrina, question or comment?
Thank you, Darren, for giving me opportunity to ask a question. That actually in your presentation, I'm sorry that I am late a little bit, but I have seen that in your presentation you have said that they don't have the IRB and the informed consent for the patient, and what's actually it is unethical if it is it is unethical. So why during the COVID-19 the protocol is not going to the IRB and taking the ethical clearance and take the informed consent?
Thank you very much. You know, the outbreak is a special situation in any country. So it is very difficult to take informed consent and other issues regarding ethical issues, but now we are developing a special guideline and we can follow the guideline. How can we address the ethical issues, confidentiality, anonymity? Because when we go for in the field to collect data or sampling, patient was distressed, they were hurried. So it is very difficult to take the informed consent. This is my objective of the study, and we can want to do this kind of research. So that's why in this case, the national consensus we came that we can develop a special guideline, and we follow the guideline and they maintain the ethical issue. And also my recommendation was that national guideline addressing ethical issues need to be developed by the stakeholders or by the policy makers. We recommend it.
Okay, thank you very much. It's a special emergency. It's interesting to reflect on that. Now it's less of an emergency. We hopefully learn our lessons. Thank you so much, Saiful. Thank you.